A mental health condition in which someone responds with fear and dread against certain things is known as anxiety disorder. Anxiety is a normal condition, and almost every people experience it, as someone fears sitting in an exam or remaining nervous to do an interview. Some people become anxious about handling problems at work, and some become nervous about making vital decisions. But all these conditions are normal with anyone. Sometimes anxiety becomes beneficial for someone. They notice danger behind them and remain focused. All these conditions are normal, but for some, it is beyond their limits, and they feel fear from time to time. At that stage, this condition becomes a mental disorder. Anxiety is itself the symptom of many conditions, such as panic disorder, phobias, social anxiety disorder, and many more. If someone feels anxious about various situations, then this disorder will be considered a generalized anxiety disorder. Researchers don't know the exact cause of this disorder, but some combinations they suspect as the cause of anxiety disorder, which includes severe chemical imbalance or heredity and environmental factors. World Health Organization report indicates that 1 out of 4 people throughout the world is experiencing anxiety disorder. In 2019, this condition affects almost 301 million people globally. Psychotherapy and sometimes medication are the ultimate treatment for anxiety disorder. Let us discuss the types of anxiety disorders, their symptoms, how they affect children, and how this could be treated or prevented. What is meant by anxiety disorder? Anxiety is a feeling of discomfort, unease, worry, or fear about any condition. It could be mild or severe. It is the most common condition of mental health. Every person has a level of anxiety, but an excessive and persistent worry about anything is called an anxiety disorder. Anxiety of a person becomes a disorder when it enters into his ability to do something, or if he overreacts when any condition triggers his emotions. Sometimes, a person can't control his response to some situations. In that case, anxiety leads to a disorder. Types of anxiety. Many types of anxiety disorder exist, which include generalized anxiety disorder, panic disorder, phobias, and separation anxiety. What is generalized anxiety disorder? If someone feels continuous fear, anxiety, or dread, even if that includes his daily life working capability, then anxiety disorder is known as generalized anxiety disorder. It's not the same as if someone is worried about things. It's when someone feels anxious for months or even years without anything that triggers his emotions or feelings. Generalized anxiety disorder is a situation in which someone permanently worries about one thing and moves towards the next one continuously. Generalized anxiety disorder can lead to both physical and mental problems. A person affected by this disorder exhibits restless feelings, experiences trouble while sleeping, has aches in muscles, can't control his worried feelings, and always feels headache. What is meant by panic disorder? A patient with panic disorder experiences intense feelings of discomfort or frequent sudden panic attacks. People feel themselves in severe fear without any trigger or unexpectedly may face any situation that is dreadful for their mental health. These attacks are just like a heart attack. In a panic disorder, people may experience pain in the chest, a feeling of heart pounding, a sense of becoming crazy or uncontrolled, and severe sweating. Panic disorder directly affects someone's mental health as the patients remain upset all the time and always become worried thinking about the next attack. What is meant by phobias? If a person feels severe or intense fear about a specific condition or situation, then anxiety turns to phobia. Phobiac patients within a particular situation feel themselves in fear out of proportion, which is caused by that condition. A person may be phobic by animals, heights, blood, or injections. Social anxiety disorder is also known as social phobia. It's a condition in which people may worry as their anxiety is triggered by others' negative behavior that makes them embarrassed. Due to this phobia, people usually avoid any social activity. Some people may have agoraphobia, a condition in which someone has a severe fear of being overwhelmed. People fear open spaces or even closed spaces, by crowds or outside of their homes. Health phobia could be called health anxiety. In this case, someone feels himself in a specific complexion relating to health, even if he started seeing symptoms. What is separation anxiety disorder? It is a condition usually experienced by children or teenagers. They do not want to stay away from their parents. They thought that if they hurt their parents, they might get separated from them and not return. People with separation anxiety disorder may fear staying away from their close ones. Due to this fear, the people do not live alone. Sometimes they see bad dreams, so they prefer to remain with their loved ones, either their parents or anyone else. The leading causes of anxiety disorder. The leading cause of anxiety disorder is still unknown. Some considered causes include medical causes, chemical imbalance, heredity, and environmental factors. Medical cause. In some people, anxiety is related to their health issues, and their signs indicate a medical illness first. Some medical conditions that induce anxiety include diabetes, heart disease, chronic bowel syndrome, and tumors. Chemical imbalance. If anyone has long-term stress, it could change his body's chemical balance, which changes his mood. Long-term chemical imbalances can lead to anxiety disorder. Environmental factor. If a person experiences trauma, it will trigger anxiety disorder. Heredity. Anxiety disorder moves forward, as it is a genetic disorder. Some people exhibit anxiety from either one of their parents. It's just like an eye color. Factors that stimulate anxiety disorder. Environmental as well as genetic factors are involved in enhancing the development of anxiety disorder. If someone has any other mental health issue, he is more likely to be affected by this disorder. Someone has a serious health issue. Experience nervousness in any new event during childhood. Having negative life events. Thyroid problems. Heart arrhythmia. Medications like caffeine. Being alcoholic. The symptoms revealed by anxious patient. Symptoms of anxiety disorder depend upon its type. Some general symptoms include cold hands, nausea, mouth drying, breathing disorder, fear and unease, bad dreams, uncontrolled thoughts, trauma experience, trouble sleeping, and ritualistic behavior. Children could also be affected by this disorder. Anxiety is a fear that enters their life as they lose the ability to enjoy their life, and both children and parents get puzzled. Diagnosis of anxiety disorder. Have you seen any symptoms of anxiety in yourself? Go and visit your physician. Your healthcare provider will take a proper medical history. Keep in mind that there is no lab test for an anxiety disorder patient. However, your physician could suggest some tests if you have physical symptoms of this disorder. Treatment for an anxiety disorder. Anxiety disorder has an essential effect on your life routine. But don't you worry? Here, we are going to elaborate on some treatments as well as self-remedies to get rid of this disorder. Talking therapies are the best method to treat anxiety disorder and could be held by psychotherapists. Some medication could also be recommended by your doctor, which might be an antidepressant. But keep in mind that long-term antidepressants could lead to many other diseases. Self-help for anxiety disorder. If you are experiencing any anxiety, you can do many things to reduce its effects without any medication. For example, take a self-help course, exercise daily, quit smoking, and take care of your physical health. Take proper care of yourself and your children against this disorder. If it is neglected or remains untreated, then someone can lose their family relations, child performance in school activities, and some specific social functions. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.